Welcome, everyone. My name is Laurie Sjostrom of Laurie Sjostrom Coaching, and today I'm here with Maja Dethloff from Sound Feelings. Maja is the UK's only instructor in Peter Hess singing bowl massage, and she can help people get the skills they need to become practitioners in the UK. And she is the only person, she's the only authorized person invited directly by Peter Hess himself to go to the UK and to set up an academy. And today we are here under remarkable circumstances. Maja has been suffering with an issue with her hips for over 15 years. And she has known for the past 15 years that one day she would need to have a hip replacement. And it wasn't long ago that the surgery was scheduled. And what's really exciting about this conversation is that today is the 21st of May, only 17 days since she had a double hip replacement. And we're going to talk to her about everything around the experience of having a double hip replacement and how what she knows from her expertise in using singing bowls, sound and vibration therapy has helped in her recovery. So I'd like to welcome Maja. Maja, welcome. Thank you so much for taking the time out of your busy schedule at the rehab facility that you're in today. I believe you're in Germany, isn't that right?
Yes, thank you so much, my dear Laurie, for inviting me to our podcast now. Yes, lots of greetings from, at the moment, Germany, where I'm, what you said, in the rehab after my hip replacement.
So, Maja, I would really like to take everyone on a little journey through what you've been going through. So before we come to the actual surgery, can you just tell me a little bit about your overall well-being before going in for surgery? Because the amazing results that you're getting come from a variety of different factors. One, of course, is your overall health and well-being, how active you are, to the skill and the professionality of the center that provided you with the surgery and then the rehab afterwards. And three, your dedication and determination to recover as quickly as possible. So I'd like to start, if you don't mind, with my asking, what was your overall health and well-being before you had to have the surgery?
First, I would say I love this to use my singing bowls, also for myself, of course. For example, I have a really, really big where I can stand in, and it's an amazing feeling. And of course, I use this bowl for myself too. And usually I go swim in the morning in the sea every morning when it's possible from the weather. And then I'm a sailor. I walk my dog every day 3 times. And I'm also go line dancing every week. And poor boy with 4 legs, I couldn't walk his usual path and also long enough for him, poor boy. But I couldn't do this anymore with my hips. It's so painful. Well, that's why it was really necessary to have the operations.
So overall, you would say that your general fitness was moderately strong. You're not like a bodybuilder or a super athlete, but you're physically fit. You get in walks 3 or 4 times a day. You go swimming. You're a sailor, and so overall, pretty physically fit going into the surgery, despite the fact that you were in excruciating pain because of the hip dysplasia. Is that what you mentioned
Yes,
to me earlier? That's the
yes,
condition you
yes.
had? Yeah.
It was really painful to walk.
Yeah. And
And
so I suppose you were really looking forward to getting this procedure done, this surgery done.
yep, yeah. And
So tell
now Uh,
Tell me about that.
um, you know, um, someone said I'm sound, and when I open my mouth, I talk about my singing bowls and how they can help, and that's why it was a must-have for me to take my bowls with me to really to the hospital just after the operation. No, start before the operation. I used them for myself too. And then I was a bit calmer. And when I woke up, of course, I was tired. But as soon as I could use the singing bowls, I started with the singing bowls and used them in the hospital every day for myself too.
So when you say you used them before the surgery, what did you do? Did you just like, I have a singing bowl here. So would you say that you just held one on your hand and struck it? Or did you actually place it on your body? Or why did you use it? Was it because it helped to relieve the pain? Or was it for anxiety purposes? Or how did the bowls help you before the surgery?
Yes, what I really often do is I use the bowl and put the bowl on my solar plexus
Oh, right here.
because, yeah, yes, because I think it's a wonderful feeling, and through the vibration, through the sound, you will become calmer. And if you become calmer, then for example, your anxiety can also come down a bit.
I know that when my, I'm going to talk about my children now, I always talk about them, but when my kids would go in to get blood drawn, if they knew and were anticipating it, they would be all tensed up, and it would be actually harder to draw the blood because their muscles would be all tight and they would be like tense.
Yeah.
And if they were like, the nurse was really funny. She took a little teddy bear and she drew blood from the teddy. And then she asked the teddy if it was okay. And then the kids calmed down. And then taking the blood actually didn't hurt at all. So that kind of anxiety can make things hurt more too, can't they?
Oh, yes, I think.
Yeah.
Because when you are anxious, then your whole muscles will cramp, are tied up. So
And
it
so
makes more.
the vibrations actually just like melt away the tension.
Yeah, yeah,
Yeah, yeah.
definitely.
So that's how you use the singing bowls beforehand to stay relaxed and to deal with the anxiety, because you didn't know what a double hip replacement would be like. So I can imagine it was pretty nerve-wracking. And then when you woke up, you also used it. And what about now that you've moved from the hospital and you're in a rehab facility, and I assume you're doing things with physiotherapists and people telling you, you know, get up and do these things, and you're like, oh, I just want to sleep. Or I don't know, what's it like? I can only just imagine.
Sometimes I have 5, 6 appointments per day. It's really exhausting,
5 or
but
6
all
appointments from the same physiotherapist will come back to you,
no
5 or 6.
different types,
Huh.
frequent training or one-to-one physiotherapy, walking school. You have to learn to walk again.
Wow, I suppose
So
so.
different
Wow.
things, and of course that use a lot of energy from the body. And when everything is okay with your whole body, no one will realize how much energy our body use for walking, sitting, um, everything around.
Yeah. And
And
all the while that you're trying to walk and do this physio and everything, your bones are healing, you're building new bone cells, your muscles are repairing,
yeah,
the skin that was cut open is healing. your nerves are repairing, so your body is working overtime just to heal, and you're doing all of this physical exercise, so you must be exhausted. But I can also imagine that with all that physio, it must be very painful.
Not really. What I can
Really?
say is that I don't have any pain with the hips. What's a bit stiffy, what you said, muscles with the skin, with a scar, that it's still a bit weird, but I can't say that I have pain.
That's interesting. And what do you put that
For me
down
too.
to? Do you think that that's because you were using the singing bowls beforehand, or do you not know for sure why that is? I mean, are you just like some sort of alien from outer space who doesn't feel pain after surgery? What's
Yes,
going on, Maya? What's happening there?
I'm really convinced about this. Using my singing bowls for myself all the time was really, really helpful.
Yeah.
I can't compare that with other hip replacements because I didn't have this before.
Yeah.
And hopefully I wouldn't have that again. But what's now, I'm
But
really happy.
But I think there was a time now, for those of you who don't know, Maya and we've been working together for about 6 months. So I've been kind of hearing the story of how singing bowls and vibrations work. And I believe, Maya, that one time you told me that by virtue of the vibrations, you get better blood circulation, you get more stimulation of your nerve cells, you get more stimulation of all of your cells in your body. So that can actually activate whatever function they're trying to carry out. So could it be that the singing bowls are actually helping you to heal faster? Is that something you teach in your summer course? Or I don't want to like lead you
Yeah.
into saying something that's not true. I'm just very curious because yeah.
I know that from myself, but also there are lots of studies around through almost 40 years when Peter has started a message in Germany, and they show a lot how the vibrations can help us. And together with the sound, really gentle sound, gentle vibrations, it is amazing what they can do. You have the bone there in your background. It's just a singing bowl without electricity, without more medications. Oh, thank you. And really high quality. I compared our bowls really often with other bowls. And also people say this, wow, that is a wonderful sound.
I'm
Some
not
of,
sure. I'm not sure if I strike it if my sound background thing will, but I'll try striking it and see if maybe it'll come up on the recording. Can you hear it?
it's difficult.
Yeah, it's
It's really
probably too
difficult.
quiet.
That's why
Yeah.
it's also one of my own thoughts. If you want to learn to give a singing bowl massage, you have to experience this in the sound room, the bowls on your own body. And how can I put my bowl on your body there?
Yeah.
So
Yeah. To
I fight for
experience it
that.
in person, it has to be experienced in person.
Yeah.
Even though we can talk about it online, it really is something
Yeah.
that if you're going to learn it properly, you have to do it in person. And you're based in Seaford in the UK, which is England, right?
Yeah.
What's the nearest well-known city close by?
Brighton.
Okay, Brighton. So that's just directly south of London, isn't it?
Yeah.
People coming from London would have to travel, what, maybe 2 hours or 3 hours to get to you? How long does it take to get there?
Of course, it depends where you live in London. When you come really from the north, you need a bit more. but I think between 1.5 hour by car, up to 2 hours, it's also fine.
Interesting. Well, we kind of got off on a tangent. I don't know how I got on that tangent. I just got curious, I guess. But I would like to go back to you, having had a double hip replacement, both sides at the same time, just 17 days ago. I remember how I was just like, my jaw dropped when you came into a meeting 5 days after your operation and you sat for an hour talking to us. 5 days after you sat. I mean,
Yeah.
I wouldn't even know you could bend after a double hip replacement, just 5 days after. So now it's 17 days later. My guess is that you're doing more than just sitting. What kind of physical things are you capable of now after 17 days?
I learned to walk the stairs. And
you can go up and down stairs now?
Yeah.
Wow.
Of course, I need my sticks. I still need them.
Okay.
And for just normal walking, I need the sticks, but it's getting better, definitely. And
what do you mean that you don't need them for standing? You can stand without them?
I can stand without the sticks.
And what if you took one tiny step? Would you fall over, or would you need the sticks?
I haven't tried this now. I don't
You
know
wouldn't.
this.
I mean, that would be crazy. You have to do what the physiotherapists say to do. But
it is that the trust has to come back. Trust in the muscles and how everything works again. But it will come back. And yesterday, I started cycling the bicycle.
Wow.
Bicycle.
You started riding bike? So that, of course, that's one of those stationary bikes in the gym. Yeah, you sit on the saddle and you just pedal. Or are you sitting in a chair with the pedal in front of you?
No, just, I don't know the name for this.
On a stationary bike?
Yeah.
Actually on the bike. Okay, cool. Yeah. Wow. So you're really
I was also surprised.
Yeah. Okay, so how much time do you still have left in the rehab facility?
I still have 2 weeks, and my plan is to walk out without the sticks.
Do people usually do that, or do they have to go home with them?
It's completely different.
It depends.
It's also it's also what you said, depends on the age and what they did. So different. But my surgeon said it should be possible.
Wow, that would be fantastic. And so this is what I want to say again, just to highlight this, because I'm still trying to figure it out. You're not sure that you can trust your muscles to do what your brain is trying to tell them to do, and you have to relearn how to walk, but you don't actually feel pain. It's just this like stiffness or this like resistance because you're not able to do the things you used to be able to do, like a weakness almost. And I suppose that means that you do a lot of sleeping, basically, to recover.
Yeah.
And do the singing bowls help you sleep all the way through the night, or do you need painkillers, or how does that? Do you wake up in the middle of the night and use the singing bowl to go back to sleep, or what happens there with your sleep?
I was really surprised by myself that I didn't take any medications anymore after 7 days.
Okay, wow.
So it means I reduce the medication minimum the 5th, 6th days. And I was really surprised.
I thought that you would be taking I thought you'd be taking pain medication for like months afterwards while you were still healing.
Not me.
Yeah. And you put that down to your basic physical fitness before going in, your age, the singing bowls, the physiotherapist's expertise in helping you, the good surgeon, everything just kind of
Yeah.
Everything
Yeah.
lined up perfectly for you and the dominoes are falling over?
Definitely, it was. I think it was almost perfect for me also to do this both sides to the same time.
Hmm. Yeah.
And
That
the
just
surgeon said,
blows my mind away. Sorry for cutting across you, but I can't believe that they're doing both hips at the same time. I mean, but I guess, like you said, if both are done at the same time, you can't favor one. And so you're not walking
yeah,
crooked and you're not making it go out of place. It's like they're equally weak, so to speak. And so they both grow strong at the same pace. That's mind blowing. Whoever thought of
yes,
that? Well, I
that
just
is,
have one more question, and that is, has anybody at the facility, whether it's patients or physiotherapists or the doctors or, the chief medical doctor, anybody said anything to you about your singing bowls and the fact that you had them there, that you were using them? Were people curious about it? What was that experience like for you?
of course, the day when I arrived, I had my first conversation with a chief medical doctor. And during this time, of course, I talked about my profession, that I'm a sound therapist and I use the singing bowls all the time for myself, that I have them with me. And he was surprised. Oh, that's wonderful. I tried them before, so I had the experience to have the bowls on my body. Wow,
That's
amazing. And
fantastic. So there's actually like a professional who does this kind of work who thinks that it's not a bad idea, who says,
yes,
yeah, that's great. That's a wonderful sort of support from real medical professionals who say this is a good thing to do. Okay. And what about other patients that saw you using them or the physios? Did anybody else say anything?
not really. When I talked with this chief medical doctor, um, he agreed with the idea. Maybe there's an opportunity to give sound journeys for the other patients here.
Okay.
And I haven't talked with other therapists here, physiotherapists, because we have such a lot to do. So I
Oh,
didn't mention the singing bowls. But when I talk with other patients here, of course, everyone asks, what are you doing? What are you doing? And I talk about my singing bowl. Oh, what is that? Very interesting. And there are also some, they say, I have to try this. So we are organizing a singing bowl sound journey. And I'm really surprised how they react about this.
so they're really positive about it.
Open for
Yeah.
that, and they want to try this.
That's great. That's fantastic. Well, Maya, there's just one more thing I need to ask you,
Mm-hmm.
and that is if anybody here is listening and they want to know more about singing bowls, about Peter Hess, about doing singing bowl practice in the UK, about learning at the academy, what should they do? Where should they go? Who should they call? What can we tell them?
I think the best way is to go on the website www.soundfeelings.uk.
Okay.
There you will find some information about the singing bowls, and also under Academy you can find the different courses. For me, of course, you have to start with level
When you
1.
say when you say under academy, you mean when you go to the Sound Feelings website, there's a
Yes.
tab that has the
Yeah.
academy listed.
Yeah. Thank you.
Okay, so you can go into, so it's not an actual different website. It's the same
No,
website with a like a
with a
there's
tab. Yeah.
home and then there's yeah, okay,
Yeah.
gotcha.
Yeah.
Okay.
And
What if somebody just wants to talk to you? Like ring ring, hello Maya.
I think my phone number is also on the website.
Oh, that's fantastic. Okay. So
And
and can they get a hold of you while you're in the rehab? No, you're not going to be available until 2 weeks from now, right? When you're done with your rehab.
um, when I have time, of course.
Really? Are you feeling well enough to take calls? That's amazing.
We talked now too.
Yeah, you
Of
look
course.
really great, but you knew about this one. This isn't it wasn't like I surprised you with a sudden phone call out of
Yes,
the blue.
but for me, again and again, when I talk about my singing bowls, and
It makes
it's
you
just
feel good.
amazing for me.
Yeah, yeah. I get a lot of good energy from talking about my work too. So I gotcha. I know what you mean.
Thank you.
Because when you share something that you really know is
Yeah,
truly going to help people
yeah,
somehow or another, it doesn't even matter if you're not listening to the singing bowls themselves. Just
yeah,
knowing that somebody out there kind of got the message, it's kind of like maybe one more life out there has been improved just a
yeah,
smidgen
yeah.
because of this.
Wow,
Yeah,
yes.
yeah,
And that is what I can feel every time again when I work with clients, how
yeah.
they feel. And maybe I can talk about another client. She can't really write a lot emails or in emails, WhatsApps. So she sent 2 sentences. I felt really well and I need this more because I think I can benefit from the singing bowls a lot.
Wow. So somebody who has serious challenges
Yeah, yeah,
communicating by text or
yeah,
typing or however,
yeah, yeah. And
sent
it
you
was
two
such a,
sentences just to tell you that.
yeah, it was
Wow.
a heartwarming, heart-touching feedback.
Yeah.
Wow, that she could feel she will have great benefits from the singing bowls when she has that more often. So we are on our way to arrange that her carer will learn the method.
Okay.
It's not really possible for me to go every day to her. It's too far.
Well,
And
in fact,
maybe also,
you are a teacher at heart. I mean, the purpose is to teach people how to do it so that they
yeah,
can spread the goodness around. I
yeah,
mean, as the only person who can teach it, the only authorized person in the UK,
yeah,
that's really what you should be spending your time doing.
yeah,
Although I suppose that there is something extra special about getting the expert
yeah.
to do your
But most
massage
of
for you.
my work is teaching other people, and it doesn't matter what background you have. You can learn this, and you can give wonderful, amazing singing bowl massage.
So you don't need to be like a physiotherapist or certified in any kind of psychology or training of any sort. You can maybe straight out of high school, you can do this and
Yes, when you learn the method, everyone can do this.
okay.
And if you have a medical background, physiotherapist, occupational therapist, maybe you are a nurse, you have a different background, you can use this for your job every day and straight after the courses, and you will get, it's also my own experience, better results when you combine the singing bowl massage maybe with physiotherapist or occupational therapy.
Yeah.
It's amazing.
Using your own specialization in a complementary fashion with the
Yeah,
singing
yeah,
bowls can get even better results.
yeah,
You
yeah,
wouldn't, I mean, if you've got the skills to do something like physiotherapy, you wouldn't stop that and take on singing bowls. You would just use them together.
yes.
And you can actually improve your results that way. That's amazing. Maya, thank you so much. I know you must be getting exhausted because you are just in
Slowly,
recovery.
slowly.
And yeah, so I'm going to let you go. Thank you so much for taking the time to talk with us today and to share what's going on with you. It's
Thank
been a
you.
really lovely conversation.
Yeah, thank you to my Laurie. Bye bye.
Bye.